mental health crisis.
Is it really that bad?
Yeah.
Disease that doesn't discriminate.
It's happening in every zip code. It's happening in every neighborhood.
And now a solution that aims to illuminate.
Our vision is to create a world of well-being for all children.
Children's Mercy, launching a new multi-pronged plan to help kids address mental health. We're hearing from parents.
It's like someone is just ripping my heart out of my body because I know my baby girl is begging for help.
Doctors and the kids themselves.
I think that if I had just had a calmer environment, things probably could have gone a lot smoother.
I met other people who were going through the same thing.
Shining a light into how these initiatives are saving lives.
What this can do will not only transform the healthcare landscape for the children, it will transform the healthcare landscape for our entire community for generations to come.
Illuminate means to make something more visible by shining a light on it. It also means to help clarify or explain. That word illuminate is both the name and purpose of a new mental health commitment and campaign at Children's Mercy Hospital. There are 4 different strategies that are a part of this plan, but tonight I want to focus on one, and that's facilitating early intervention. One way the hospital is doing it is by taking mental health professionals directly to children and families.
How serious would you say our mental health crisis is with young people?
Very serious. I've been doing this for about 25 years, and I don't know that I've ever seen the number of kids that are suffering from mental health issues in a variety of capacities.
That dim reality is supported by the data. 1 in 5 kids from 3 to 17 years old suffers from a mental health disorder, according to the Centers for Disease Control.
And unfortunately, in the Kansas City region, in Missouri, and in Kansas, the statistics are even more sobering. We estimate that maybe only 30 to 40% of those children are actually getting the help that they need.
Not only that, on average, the wait time for mental health services for children can be 6 to 9 months. So after years of research and community feedback, Children's Mercy Hospital announced its plan for brighter days.
Tell me about Illuminate.
Yeah. Well, illuminate is a metaphor that we are using to describe our bold strategic investment in addressing the mental health crisis that has been impacting children really for years, but especially exacerbated through the pandemic and now in our post-pandemic world.
$150 million will be invested into 14 programs over 5 years, starting with a pilot that's walking mental health professionals like Sean Haley into pediatric offices throughout the metro.
It's difficult. There's long wait lists to get in with providers. There's a severe lack of psychiatrists to do med management and monitor kids in that capacity.
What kind of a difference has it already made, or do you hope it will make?
I am hopeful that it will help families get immediate mental health issues covered. It is meant to be a bridge towards waiting for a more permanent mental health home, but I'm very hopeful. I know that at least one of my partners has already had a patient in the office who needed something right then and there and was able to call Sean and get him to help that family. So that was awesome.
So in the schools, in the offices of the pediatricians, we are embedding professionals that can help evaluate, screen, diagnose, and ensure that a child gets to the right caregiver at the right time before the crisis occurs.
How unique is it to be in like a community clinic like this?
I mean, I think really access is difficult for families right now. You know, there's a number of things that impact the family's ability to access mental health services. One thing that is accessible right now is pediatric care, and you know, embedding clinicians in this environment I think is a great first step.
When someone here in the office says, "Hey Sean, could you pop in?" What is that feeling like for you?
You know, I love going in and just sitting with the parents and family and just having a conversation. I think that's really at the heart of what I do, is having a conversation, slowing the pace down a little bit.
Shedding light on how kids and families can help themselves with Children's Mercy as a beacon.
I am very excited that kids will get the help they need, and I hope that it also helps families be able to reach out because they feel like there is an opportunity for their child to get help.
The families are really receptive and excited for the service too. The lines out the door as soon as the announcement went out. There's been a ton of interest, so I think it's a great model.
This marks the first of a 3-part series that will continue tomorrow and Tuesday, illustrating more of the elements already in motion to help address the mental health crisis in young people both in and around Kansas City. Tomorrow, meet a teen who's opening up about her anxiety after completing a new clinic created with kids like her in mind. I sat down with her and her mom to learn more. You'll hear from them both, along with the medical director who helped craft the program. Later this